Neil Hamilton.
Question 6, Neil Hamilton.
Will Cabinet Secretary make a statement on the current provision of general practices in Wales?
Thank you. We are committed to high-quality general practice as a core part of our modern primary care service. Investment in general medical services will increase by £27 million in this financial year. This, together with the £40 million of primary care estates and our £43 million primary care fund, supports the ongoing provision of sustainable and high-quality general practice.
Well, I'm grateful for that reply, but the Cabinet Secretary will know that the National Survey for Wales found that 39% of respondents find it difficult to make a convenient appointment to see a GP, and 62% overall were not satisfied with the service provided by the NHS in Wales. Since 2004, as a proportion of NHS funding, general practice has declined from 10% of the total to 8%. Admittedly, that's gone up recently. But the BMA say that in order to get to a satisfactory position, this should be 12% of what we currently spend on the NHS. So can the Cabinet Secretary give us an idea of what response he would make to the BMA about that figure?
To be fair, this is the General Practice Committee of the BMA. I'm robustly confident that clinicians in secondary care would not wish to see a significant resource transfer between secondary and primary care, and that is an honest part of our challenge. As we increase money going into the health service, as I said, at a painful and significant cost to other parts of public spending activity here in Wales, when you think about how and where we'll invest that money, and the honest truth is that delivering services in secondary care is more expensive than delivering services in primary care. So even as we invest in trying to deliver more care closer to home, the example that Angela Burns gave earlier, that doesn't always have the same cost attached, for example, as the significant capital you need to invest in, for example, a new generation of radiologists. So there are honest choices to make here. What I'm determined to do is, as services move and are reconfigured, that funding is provided to make sure that service is properly and adequately resourced. I don't think it's helpful to try and stick to a percentage figure within the NHS budget as the aim and the objective. The aim and the objective must be to deliver the right care at the right time in the right place and with the right resources to allow people to do so.
David